Namaste and a good day to you. I'm your helpful Indian. A warm welcome to you on this channel, and I thank you very much for choosing to watch this video. Without any delay, I ask you, do you have any cramping kind of pain or a squeezing kind of pain in the upper abdomen just under the ribs on the right side? Does this pain trouble you regularly, or does this pain occur or start regularly? Does this pain start especially after meals? Especially after you had some food? Do you also feel nauseous? Do you have that feeling that you may vomit? Or do you have the complaint of vomiting, or do you have the issue of vomiting along with the stomach pain? Then this video might be helpful to you. This video is about cholecystitis and cholelithiasis. But an important question, do you have such a pain right now at this very moment? Do you additionally have breathlessness? Then it is possible that these symptoms are either because of a heart attack or because of a pneumothorax. If you are having such a pain right now, then I request you to call an ambulance immediately and to describe to them your complaints or your issues, or please get to a hospital immediately if a hospital is nearby. Okay, because these are emergencies, and an immediate treatment is very necessary. But if you're all right and if you don't have any of these symptoms or issues, I have to inform you regarding something more or something else before I begin. This video contains images, or I'm using some images in this video, images of internal organs and sometimes with blood. These images might not be very nice for some people. These images may cause anxiety for some people. I did not use any sensors, or I did not use any other color. I did not hide anything. So if you are someone who has difficulty in looking at such images which have blood and other such images, then I request you to not watch this video if possible. But if you don't have any such issues, and if you are able to look at such difficult images, then please continue watching this video. Once again, I would like to state that this video is about cholecystitis and cholelithiasis. If affected, the person suddenly has severe cramping kind of pain or squeezing kind of pain in the upper abdomen. This pain normally happens, or it starts, on the right side of the abdomen and under the ribs. Nausea and vomiting may also be present. The person's skin and the white part of the eyes of the person may develop a yellowish color. The person may also be brought to the hospital in an unresponsive state or in a comatose state. Additionally, the person may have elevated body temperature, and more of the symptoms may occur, which you see on the screen right now. But all of these symptoms need not be present in every affected person. The pain usually occurs in the right side of the upper abdomen, but the pain may also radiate or spread to the back into the area between the shoulder blades, or the pain may spread to both the shoulders. Normally, this pain radiates or spreads to the tip of the right shoulder. There is an explanation for this. The liver is located below the diaphragm. The phrenic nerve is responsible for the nerve supply of the diaphragm. In presence of gallstones, and in the case of an inflamed gallbladder, the phrenic nerve becomes irritated, and this confuses the brain, which is why a person with cholelithiasis or a person with cholecystitis might experience pain in one shoulder or pain in both shoulders. The following might explain the reason for this confusion. Parts of some nerves that transmit brain signals from the shoulders to the brain and the phrenic nerve share the same nerve roots, and they originate from the spinal cord at the same place, or they originate from the same place at the spinal cord. This is why the brain becomes confused after getting these pain signals, and the brain mistakes pain or irritation from the diaphragm as pain from the shoulders. The white area of the eyes of the affected person may become yellowish, which occurs due to the elevated bilirubin levels in the blood. Yeah, but we should know that not just one eye, but both eyes may be affected. The affected person's skin may also be affected. I mean, the affected person's skin could also turn yellow. This picture shows us the difference between the skin of a healthy person and the skin of a person with jaundice. This yellow skin. I hope you are able to see this difference or understand this difference. It is very possible that the affected person might have the complaints of nausea or vomiting. This happens through various pathways. As you can see on the screen right now, the severe, strong upper abdomen pain triggers the vomiting reflex in the body. An inflamed gallbladder also disturbs the normal digestive processes which happen in the stomach and in the intestines. This leads to nausea and vomiting. As bile juice cannot flow into the duodenum due to the presence of gallstones or due to an inflamed gallbladder or due to inflamed bile ducts, the fatty substances and the other materials which were consumed or eaten are not properly digested. This interrupts or this disturbs digestion, and that later leads to vomiting. Due to the presence of gallstones and due to an inflamed gallbladder, the gallbladder becomes infected, and this infection leads to the release of toxins and bacteria into the bloodstream. This also could lead to nausea and vomiting. Cholecystitis or inflammation of the gallbladder develops after an obstruction or blockage of the neck of the gallbladder, or after the blockage of the cystic duct, or after the blockage of the common bile duct. This blockage occurs due to gallstones, parasitic worms, a biliary tumor, bacterial or viral infections, and other obstructions. Possible causes also include the formation of sludge, which occurs because of increased intake of fatty or oily foods. These are the risk factors which contribute to the development of cholecystitis. Cholecystitis is common among people who are over 40 years of age. It happens especially among women, or cholecystitis can develop especially among women, even among pregnant women. Cholecystitis can also occur among obese people. It can occur among people who have certain infections, or it can occur among people who had certain infections such as malaria or dengue fever. And it could happen among people with elevated levels of fats in the blood. A family history of having gallstones or a family history of cholecystitis also contribute to the increase in chances of a person developing this. Diet also plays a significant role. The other factors which you see on the screen right now, which I haven't mentioned, also contribute to the development of cholecystitis. Cholelithiasis is a general term for the conditions in which there is a presence of gallstones in the biliary tree. Most frequently, two types of cholelithiasis occur: cholecystolithiasis and choledocholithiasis. There is also hepatolithiasis, and in this condition, There are gallstones in the bile ducts which are inside the liver or in the hepatic ducts. Hepatolithiasis usually or commonly occurs among people who are East Asian. For example, it occurs commonly among people who are Chinese people and among Taiwanese people or among people from Taiwan and among people from other Eastern countries. There are different types of gallstones. The affected person could have cholesterol gallstones or pigmented gallstones or even mixed gallstones if the person has cholelithiasis. Cholesterol gallstones are made up of cholesterol monohydrate crystals, calcium salts, bile pigment, proteins, and fatty acids. Cholesterol gallstones are usually yellow to green in color. They range between yellow and green. Pigmented gallstones are made up of calcium salts of bilirubin, phosphate, calcium carbonate, and other anions. Their color ranges from dark brown to black. Mixed gallstones are made up of a mixture of these chemicals or a mixture of these salts or a mixture of these constituents which are seen in cholesterol gallstones and in pigmented gallstones. And the color of the mixed gallstones is different. Their color depends on what they are made up of, as you can see on the screen right now. These are the risk factors which contribute to the formation of cholesterol gallstones, and these are the risk factors which contribute to the formation of pigmented gallstones. A sedentary lifestyle is a risk factor for the formation of both types of gallstones. This is a lifestyle which a person has in which the person spends the maximum time of the day sitting and moving very little. There is actually a mnemonic for the risk factors that commonly contribute to the formation of gallstones in a person. 5 F's. So F, female gender, or it happens commonly among women. Fertile, it happens commonly among women who belong to that age in which they could become pregnant. Fatty body, or it could happen among people who are obese. These gallstones could develop among people who are fair or among people who have a light colored skin. 40, or this could happen among people who are older than 40 years of age. Regarding the risk factor fair, I should state that there is an exception. Among American Indians and among Hispanic Americans, gallstones could form due to genetic reasons regardless of the color of their skin. By American Indians, I don't mean NRIs. I don't mean non-resident Indians. I hope you understand what I mean here. Okay, so these factors or these 5 F's also contribute to the development of cholecystitis. So being female, being more than 40 years of age, being obese, being of that age during which the woman can get pregnant, and having fair skin. But not all of these factors must be present in all people in order to cause these issues in that person. One or some of these factors could contribute to the origin or to the development of gallstones in the person, okay, or to the development of cholecystitis in the person. Now I would like to explain a little about the anatomy of the liver. Let us assume that what we now see on the screen is a picture of the liver. The gallbladder is below the liver. The liver has a left lobe and a right lobe, which contain or which have the left hepatic duct and the right hepatic duct. The left hepatic duct and the right hepatic duct unite to form the common hepatic duct. These ducts guide or direct the bile juice from the liver into the gallbladder where the bile juice remains. The cystic duct from the gallbladder then connects with the common hepatic duct where the common bile duct originates. Bile juice normally contains water, bile salts, cholesterol, phospholipids, bilirubin, electrolytes and other things. There are two types of bilirubin: direct or conjugated bilirubin and indirect or unconjugated bilirubin. Due to a few special transport systems, only the direct conjugated bilirubin is used in digestion. The indirect unconjugated bilirubin is converted by the liver into direct bilirubin. After the intake of food and in the presence of fatty acids, amino acids and hydrochloric acid in the duodenum, the hormone cholecystokinin is released or it is secreted. Then the cholecystokinin hormone triggers the contraction of the gallbladder. After that, the bile juice reaches the duodenum, or after the contraction of the gallbladder, the bile juice is sent through the cystic ducts and then the common bile duct into the duodenum. Cholecystolithiasis occurs because of the formation of gallstones in the gallbladder. When the cystic duct or the common bile duct are blocked, then this obstruction will lead to buildup or a stasis of bile juice. So bile stasis or cholestasis is the accumulation of bile juice within the bile ducts or within the biliary tree. After this, sedimentation of the bile juice happens in the gallbladder. This leads to cholecystolithiasis. Such a blockage occurs due to gallstones, worms, biliary tumors, inflammations, etc. Similarly, choledocholithiasis happens after a buildup of bile juice, which happens after the obstruction of the common bile duct. One or more gallstones form in the common bile duct. So, as already mentioned, this condition is called choledocholithiasis. But among 10 to 15% of the cases of choledocholithiasis, the problems or the symptoms start after the gallstones migrate from the gallbladder into the common bile duct. Okay. It is important to note that the affected person may also develop fever. Among the people with these illnesses or conditions, there is a bile stasis or there is a buildup of bile which happens due to the obstruction of the bile ducts. As a result of this stasis or as a result of this obstruction, bacteria starts to grow within the gallbladder. This leads to infection and the release of inflammatory mediators into the bloodstream. The body also has an increase in the temperature as an immune response to the pathogen. These changes lead to an elevation in the body temperature. This elevated body temperature may also be accompanied by chills or shivering maybe. Okay. Inflammation of bile ducts is called cholangitis, which usually happens among people with the illnesses or the conditions I have mentioned so far in this video. Among people with this condition, there are symptoms such as jaundice, fever, and pain in the right upper abdomen. Such people are treated with antibiotics and by the removal or by the treatment of the underlying causes or by treating those issues which are causing this problem. Among people who fast or among people who starve and among people who are fed or nourished intravenously for prolonged periods of time, there is no release of cholecystokinin hormone due to the limited or absent intake of food. Due to that, the gallbladder does not contract and the bile juice remains in the gallbladder for a prolonged period of time. Among these individuals, cholesterol secretion into the bile juice increases. These changes or these factors lead to the crystallization of cholesterol. Over time, more cholesterol accumulates on these crystals. These crystals also bind with each other. In these ways, these crystals become larger. Among people who lose weight rapidly or who lose weight too fast, there is a faster breakdown of fat due to increased or accelerated metabolic rate. As a result of this, there is an increased release of cholesterol into the bile juice. Because of reduced food intake, there is also reduced release of bile acids into the bile juice. Due to this, the concentration of cholesterol in the bile juice increases. Because of the reduced amount of bile acids in the bile juice, the solubility of cholesterol in the bile juice reduces. There is also weak gallbladder activity among these individuals. Due to these reasons, bile remains in the gallbladder for a longer period of time, and due to these reasons, there is a crystallization of cholesterol. And slowly gallstones form. Among women who are fertile or among women before menopause, there is a possibility that blood levels of estrogen may increase. Elevated blood levels of estrogen lead to an increased excretion of cholesterol into the bile juice. Gallstones form then. I hope I'm not confusing you. Okay. It should also be known that bile juice is the reason for the normal brown color of the stools or the feces. The normal brown color of the stools is because of bile juice. Normally, the old damaged red blood cells are broken down by the reticuloendothelial system in the spleen and in the liver. After this, hemoglobin is produced, which is further separated or split up into heme and globin by the macrophages. Okay. Globin is further converted or broken down into amino acids by the enzyme protease. Heme is converted or broken down into biliverdin. Then biliverdin is broken down into indirect bilirubin, which is later converted in the liver into direct bilirubin. After the gallbladder contracts, bilirubin along with the bile juice enters the duodenum. The food is then slowly digested. In the large intestine, the bilirubin, which is now mixed with the food, is converted into urobilinogen by the bacteria. Some of the urobilinogen is converted into urobilin, which is excreted by the kidneys. But the majority of urobilinogen is converted into stercobilinogen, which is later converted into stercobilin. Stercobilin and stercobilinogen are excreted in the stools. Stercobilin and stercobilinogen give the stools the brown color which the stools have. This is how the stool, or which is how the stools get this brown color. It is important to know that the stools of a person with cholelithiasis or choledocholithiasis can be white, grey, or somewhat clay-like in color. This happens because among such people, the bile juice does not reach the duodenum due to the blocked bile ducts. Okay, stool may also be grey or white among people with liver diseases such as cancer and other diseases. Due to the blockage of bile ducts among the people With these conditions, the return of bilirubin to the liver happens. I mean, due to this blockage, the bilirubin flows back or goes back in the direction of the liver, and this slowly leads to an elevated blood level of total bilirubin. Okay, this reverse flow of bilirubin in the direction of the liver leads to an increase in the amount of bilirubin in the blood. As you already know, the liver converts indirect bilirubin into direct bilirubin. Direct bilirubin is water soluble. Because of that, some of it is excreted by the kidneys. For this reason, the color of the urine changes. Okay, according to the level of bilirubin in the urine, the color of the urine among such people can range between brownish and peach colored. If bilirubin and urobilin are present in the urine, then according to the levels of these bile pigments in the urine could have a specific different color. Although I have already mentioned these symptoms, I must mention that some affected individuals may also experience itching. Different people may experience more or fewer of these symptoms, and there is no rule that all of these symptoms have to occur in every affected person. So, if this pain ever starts, then it would start suddenly and it would intensify rapidly. This pain could last for hours or hours, and it could increase over time. Some people describe this pain as being intense, gripping, stabbing, or even gnawing. So, if you or if someone you know suddenly start having these symptoms or these complaints, then I request you to call an ambulance immediately, or please go to the hospital immediately if a hospital is nearby, or please take the affected person to the hospital immediately if there is a hospital nearby. I request you to do this because the cause of these symptoms could also be a heart attack. This is why an ECG is done first after a person with these symptoms arrives at the hospital. This is done to rule out or to confirm a heart attack. What you are now seeing on the screen is the ECG of a healthy person. There is no evidence of a heart attack in this person. If the person is also experiencing severe breathlessness, an X-ray of the chest will also be done, as these symptoms could also be caused by a tension pneumothorax in the person. This R shows that this side is the right side of the chest. In a person with tension pneumothorax, there is an abnormal accumulation of air in the chest cavity, which is visible on the left side of this person's chest in this X-ray. As already explained, this X-ray is of a person who has tension pneumothorax. This is a life-threatening condition. The changes are more visible in this image. The pathological accumulation of air compresses one lung and it forces the organs such as the lungs, heart, trachea, etc. to the other side of the chest. And this due to this, the other lung is also compressed. This is the chest X-ray of a healthy person who doesn't have pneumothorax, and this is so that you could compare this X-ray with the previous X-ray I showed. Okay, so a chest X-ray and an ECG are necessary as soon as the person with these symptoms reaches a hospital, because pneumothorax and heart attack are emergencies, and the person might not survive if they do not receive the appropriate treatment as soon as possible. After ruling out the possibility of these emergencies, or after confirming that the person with these issues is suffering from neither a heart attack nor from pneumothorax, an examination of the abdomen is done. The best way to do this examination, or the best way to examine the abdomen, is when the person is lying down. In the second image, we see a specific lying down position. The reason for examining any person in this position is that there is reduced or no tension of the muscles of the abdomen in this position. This allows the doctor to palpate or to examine the abdomen deeply and more thoroughly. An additional reason for examining any person in this position is shown in this image, that the person would feel more comfortable and experience lesser pain in this position. During this examination, the patient is instructed or requested to deep breathe, and when the doctor presses into this area on the right side under the ribs, or when the doctor examines in this area within this circle, then the patient may feel pain and stop breathing, temporarily. This is a sign and it is called Murphy's sign. But the confirmation of the underlying issue, or the confirmation of the issue, what's causing these symptoms, is done using imaging investigations such as ultrasound, CT scan, and other things. Cholecystitis can be confirmed by ultrasound investigation of the abdomen, CT scan of the abdomen, MRCP, and other things. This is an image of the gallbladder in a person with cholecystitis. This image was taken during an ultrasound investigation. Here we can see a buildup of sludge, and the triangle is under this sludge. The straight arrow is pointing, or it shows the thickened wall of the gallbladder. Cholelithiasis is confirmed by ultrasound investigation of the abdomen, MRCP, or CT scan of the abdomen, and other things. One should know that only about 15 to 20% of the gallstones are radio-opaque. So it is not always possible to confirm the presence of gallstones using X-ray investigations. In most cases, gallstones can be detected using ultrasound investigation. So this is an image of the gallbladder which was taken during an ultrasound investigation. Hopefully you can see the gallstones in the gallbladder in this image of the gallbladder in this person. Okay, so as already explained, gallstones are sometimes found out accidentally, or they are discovered accidentally on X-ray. So this is an X-ray of the abdomen of a person, and we can see two large gallstones in this X-ray image of the person. In this X-ray image of the abdomen, we also see calcified mesenteric lymph nodes along with the calcified gallstones. This is an image of the organs in the abdomen which was acquired by MRCP. We can see that the gallbladder is full of gallstones and the cystic duct is blocked by a gallstone. This is the CT scan of the abdomen, and here we can see two large gallstones. Cholelithiasis can be confirmed by ultrasound scan of the abdomen, EUS, CT scan of the abdomen, and by other investigations. It should also be known that cholelithiasis can occur even after the removal of the gallbladder. This image shows gallstones in the common bile duct in a person, and this shows or this proves cholelithiasis. This image was taken during endoscopic ultrasound investigation. This image was taken during MRCP investigation. We can see that the arrows show the gallstones in the common bile duct. This confirms cholelithiasis. This is a CT scan of the abdomen of a person. The arrows show a gallstone here. And coming to hepatolithiasis, if a person has hepatolithiasis, it can be confirmed using ultrasound investigation of the abdomen and some other imaging procedures. It should also be noted that the problem or the condition of hepatolithiasis can develop even after the removal of the gallbladder. This is an image of the screen which was taken during an ultrasound investigation of the abdomen. In this image, we can see a gallstone in a hepatic duct. This is another example, and there are more gallstones here, I think. This is the image of a CT scan of the abdomen, and in this image or in this slide of the liver, the arrows show us some gallstones, I think. Additionally, some blood tests are done along with these imaging procedures. These blood tests can detect the changes in the blood levels of the enzymes of the liver and in the blood levels of bilirubin. What we now see on the screen is the result of an LFT or liver function test investigation of mine, which was done a long time ago. The report of a complete blood picture could show leukocytosis or an increase in the number of white blood cells. A leukocytosis is a sign of infection in the body. What we now see on the screen is a normal result of CBP or complete blood picture of mine, which was done a long time ago. A blood culture could also be done among the affected people, but this is done before the antibiotic treatment is started in or for the affected person. This test helps determine what kind of a bacterial pathogen is growing in the person's blood. I mean, if any bacterial pathogen is growing in the person's blood. Okay. In the case of an acute cholecystitis or in the case of inflammation of gallbladder which developed recently, antibiotics are used, such as cefuroxime and other medications. Experienced physicians may prescribe other or even more or even better antibiotics. Antacids such as pantoprazole, omeprazole, and other antacids are additionally prescribed to counteract some of the side effects of the antibiotic. Antiemetics or medicines against nausea and vomitings such as ondansetron or metoclopramide are given to treat vomiting and nausea. Medicines such as paracetamol, aceclofenac, and diclofenac may be given for pain relief. Other medicines may also be given or prescribed as needed. Laparoscopic cholecystectomy is the optimal method of treatment when cholecystitis worsens despite medical treatment and when further complications such as perforation of the gallbladder or an empyema are expected. An open cholecystectomy might be done if the laparoscopic cholecystectomy is not possible, or if it is complicated, or if the affected person is obese. Okay. Gastroenterologists sometimes decide to treat the person through laparoscopic cholecystectomy even when the person is obese, but complications could develop during laparoscopic procedure, in which case the laparoscopic procedure is converted into an open cholecystectomy. By complications, I mean that during the laparoscopic procedure, the gallbladder might not be visible, or that there might be many adhesions between the gallbladder and the other hollow organs, or a severe uncontrollable bleeding might begin. Okay, in case of cholecystitis, which repeatedly occurs or which repeatedly bothers the person, or which has been bothering the person since a long time, or which has been present in that person since a long time, the same treatment could be offered, but an elective laparoscopic cholecystectomy would be usually recommended. Elective means planned, and an appointment is scheduled for this operation. I should mention again that the laparoscopic cholecystectomy will be converted to an open cholecystectomy if complications arise during the laparoscopic procedure. A person with cholecystolithiasis, or a person with stones in the gallbladder, will be treated in the following way. The medical treatment involves prescription of tablets with ursodeoxycholic acid to dissolve the gallstones, and the other treatment involves giving antibiotics and medicines that lead to symptomatic improvement, such as painkillers, antiemetics, etc. And the affected person may also be treated with lithotripsy and endoscopic procedures such as ERCP. Okay. If large or many gallstones are present, a laparoscopic cholecystectomy is performed. Again, I must mention that if a laparoscopic cholecystectomy is not possible, then an open cholecystectomy is done. Or if complications arise during the laparoscopic operation, then the laparoscopic cholecystectomy is converted into an open cholecystectomy. I would like to share an experience with you regarding this. In 2013, and in India, a 72-year-old family friend of mine had these issues. So basically, he had severe pain in the upper abdomen, and up to that point of time, he already had suffered 2 heart attacks. That is why he was taken to a cardiology hospital in India and he was admitted there. I think that this was done because his ECG showed some abnormalities such as deep pathological Q waves. In this image, the arrows show the deep pathological Q waves. This is an image of another ECG. Here the red arrows show the deep pathological Q waves. I read that even 25 years after a heart attack, the signs of the previous heart attack are visible on the ECG as deep pathological Q waves. I believe that this is why my family friend was admitted in this cardiology hospital or his cardiology clinic. Despite the treatment at this cardiology clinic, there was no improvement in this man's condition. Then he was taken by his family to a super specialty hospital. At this hospital, it was discovered that he had gallstones in the gallbladder. And at this super specialty hospital, the gastroenterologist first attempted to remove this man's gallbladder through a laparoscopic cholecystectomy. But complications arose during the operation, and the operation was then converted into an open cholecystectomy. After this operation, this man's condition improved. Okay, a person with choledocholithiasis could be treated this way. Pain relief medicines such as paracetamol and other painkillers, intravenous fluids, and antibiotics are given. Ursodeoxycholic acid tablets are also given to dissolve the gallstones, but it could take months or years to dissolve the gallstones. That is why the minimally invasive procedure of ERCP is the optimal method of treatment to treat a person with choledocholithiasis. And this is done after choledocholithiasis has been confirmed through imaging procedures. ERCP stands for endoscopic retrograde cholangiopancreatography. If ERCP is unsuccessful or if there are difficulties, other endoscopic procedures or other surgical procedures or extracorporeal shock wave lithotripsy could be done to treat the person. If the person is diagnosed with hepatolithiasis, then non-invasive treatment could be done with ursodeoxycholic acid tablets, antibiotics, intravenous fluids, lactose syrup, etc. Endoscopic procedures or various types of lithotripsy may also be done. Depending on the affected parts of the liver, the patient may undergo either a partial or a total hepatectomy. Liver transplantation may also be considered among these individuals. It is known that gallstones are the cause of gallbladder cancer in 70 to 80% of the cases of gallbladder cancer. That is why patients undergo cholecystectomy if a calcified gallbladder is confirmed among them. According to a study, uh, gallbladder cancer is found among 1 to 3% of the gallbladders which were removed due to these types of gallbladder disorders. Okay, uh, yeah, so that could be done, but such surgical treatment is not always considered because a surgery carries its own risks. Okay, let us assume that this is an image that shows the biliary tree. Very rarely, gallstones obstruct the common bile duct and the pancreatic duct when the gallstones are in the hepatopancreatic ampulla or in the ampulla of water or water. Then jaundice, other problems of the liver, and pancreatitis occur. These problems are then treated simultaneously. Okay. Sometimes there are a few exceptions. I mean, sometimes a blood test is the only way it is found out that a person has these issues, even though the person has no symptoms. Okay. Such people might easily tolerate the pain in the abdomen without any problems, and there might be no additional symptoms like vomiting, nausea, etc. Or they might not even know that they have this issue. This is a rare case, but it is possible. These are the other possible diagnoses or diagnoses, or these are the other illnesses that can cause or trigger these symptoms. These include heart attack, esophagitis, aortic dissection, gastritis, gastric ulcer, duodenal ulcer, appendicitis, diverticulitis, and there are a few other diseases or conditions. But the treating doctor would look for the pathological changes of these diseases in the affected person using endoscopy, colonoscopy, CT scan, and other investigations. If the affected person has the complaints or the signs which show the presence of these issues in that person. Basically, a burning pain in the abdomen, vomiting of blood, or coffee colored vomiting are signs of stomach ulcer, gastritis, and some types of cancer. If a person is vomiting blood, the first step is the use of endoscopic methods to stop the bleeding. Yeah, so that could be done. Okay. And regarding these complaints, I should say that hepatitis could be present in the person, which worsens the person's condition and triggers the previously mentioned symptoms. Hepatitis is a viral infection and it can only be diagnosed by blood tests, and blood is investigated for the presence of the responsible antigens and antibodies of different types of hepatitis viruses in the blood of the person. This is a result of the blood test of hepatitis or for hepatitis A antibodies. Okay, and this is the report of test for the hepatitis B surface antigen, and this is the report of a test for hepatitis C antibodies. Okay, these are blood tests of mine which were done a long time ago. Okay, so sometimes a gallstone which has a diameter of more than 2.5 centimeters migrates into the intestine, and that happens after the gallstone has passed through a fistula or through the common bile duct. And a diagrammatic representation of that is shown here. A fistula is an unnatural connection between the hollow organs. According to the location of the gallstone could block either the end of the duodenum or the sigmoid colon or another part of the intestine, which would lead to a gallstone ileus. I think you already know the symptoms of an intestinal obstruction, but still I would like to mention them. Okay, the affected person would have been experiencing pain in the abdomen since a few days or since some time. The person would also be having constipation since some time. The issue of vomiting would also have been present in the person since some time. And the abdomen of the person could become swollen due to the accumulation of air, fluids, or because of the food which the person ate. And this would lead to something that is called bloating. And I should also mention that there would be no farts in the person with gallstone ileus. I mean, there would be no wind. There would be no flatulence. Okay, I hope you understand what I mean. During the examination of the person, during the physical examination of the person, we can feel greatly increased or accelerated movement of the hollow organs in the abdomen, and using a stethoscope we can also hear louder noises from these internal hollow organs. Okay, specific CT scans and some blood tests will also be done to find out what's happening. Blood tests also show signs of infection in these people. A deficiency of vitamin K may also be present among these people. Treatment of this problem is usually surgical, and the procedure is called enterolithotomy. This type of bowel obstruction is rare, but it is possible. I apologize that the organs in this image are not censored. I'm sorry. Regarding the size of the gallstones, I would like to share this image with you. Here you can see how large the gallstones could be. I apologize, but I'm not sure if the left image is a picture of the removed gallbladder or if it is a picture of a part of the intestine. But we can see the size of the gallstones here. Okay, this is a picture of the intestine and the gallstone taken during the operation. Here, the gallstone is more than 4 centimeters long in this person. If a person has a chronic liver disease and if this person develops these symptoms like pain in the abdomen and vomiting of blood, then it could be because of bleeding from the esophageal varices. I mean, these symptoms could be because of bleeding from the esophageal varices. These varices are enlarged veins which are located inside the esophagus and near its lower end. If a rupture happens, the vessels bleed. The bleeding which is visible in this image is minimal or minor, but this is major. After the confirmation of this bleeding by endoscopy, it is treated as follows. Vasopressors such as vasopressin, somatostatin, and terlipressin could be given to reduce the blood flow to the portal vein and as a result to reduce the bleeding. Antihypertensive medicines help reduce the blood pressure in the portal vein. Antibiotics such as ceftriaxone or norfloxacin are given. Intravenous fluids will also be helpful. Certain antacids such as proton pump inhibitors like omeprazole, pantoprazole, etc. help prevent stomach ulcers or they help prevent the worsening of stomach ulcers. Laxatives such as lactulose are given to prevent hepatic encephalopathy. Once the person could consume food, I assume. Okay. Emergency treatment will be needed and medical measures could prevent failure of the circulatory system, by giving transfusions of blood and by giving an infusion of plasma. That could be done. And endoscopic treatment is carried out using procedures such as rubber band ligation, balloon tamponade or tamponade, and other things. Intravenous treatment such as sclerotherapy could be done. Surgical treatment of this issue is also possible through procedures like TIPSS, through shunt operations, and through other procedures. The goal of these treatments is to reduce the pressure in the portal vein and to stop the bleeding. The logic or the point here is that when the pressure in the portal vein reduces, the intensity of the bleeding also reduces. A very important point is that medicines such as paracetamol, which are very commonly taken for pain relief, are metabolized or broken down by the liver. This is why the liver will be damaged after regular or increased intake of paracetamol, or the liver will be damaged because of regular or increased intake of paracetamol. As a result of this damage, jaundice and other problems of the liver happen. For this reason, there are rules that we must not give a person more than 3 to 4 grams of paracetamol per day. I mean, this is the rule in India, at least I think. Okay. So if someone has already been given 3 to 4 grams of paracetamol on that day, and if the person still has fever, and or if the person still has pain, then other methods are used to treat the person. So if a person has fever, the person's body is wiped with a lukewarm wet cloth, and this is called tepid sponging. Okay. For pain, medicines such as aceclofenac and diclofenac are given. Now, I want to, or I would like to tell you something important about lactulose, which basically is a laxative. So, why this is important, I'll explain. Due to the reduced function of the liver, incomplete digestion of the things happens. I mean, the things which were consumed or eaten will not be digested properly or completely. As a result of this, the presence of ammonia in the intestine increases, which is absorbed by the large intestine. Due to the increased blood value of ammonia, which happens after the absorption from the large intestine, permanent damage to the brain or hepatic encephalopathy occurs. And if hepatic encephalopathy happens, then the affected person could slowly fall into a coma. That is why lactulose syrup is given to the affected people. What happens is that in the large intestine, lactulose converts into lactic acid with the help of the bacteria or because of the bacteria in the large intestine. And lactic acid converts ammonia into ammonium ion. These ammonium ions cannot be absorbed by the intestines, and they are excreted with the stools by the body. As a result, the blood level of ammonia would not increase and hepatic encephalopathy would be prevented. Since doctors usually examine the person and since they treat the person according to their symptoms or according to their complaints and the signs in them, it is very important that the affected person explains or shares all the complaints the affected person has, if possible, to the doctor, I mean. So all the complaints, it's better if all the complaints are shared with the doctor or to the doctor. For example, the type of pain, if it is a burning type of pain or a cramping type of pain or a squeezing type of pain, and if there are any accompanying symptoms, and all other things need to be shared. Otherwise, a little more time will pass before the affected person receives the appropriate treatment. Usually, the doctors find out the underlying problems or the changes, but before that happens, the affected person's condition could get even more worse. Yeah, and there will also be a little loss of time. Okay, so one should know that the liver is a kind of a hero whose importance we don't take seriously. In English, as we say, GOAT or greatest of all time to describe a person, in the same way, the liver is the greatest organ of all time. Most of the time, we don't care about the liver, and that brings us problems or that causes problems in us. Yeah, okay. So the following could happen among people with cholecystolithiasis and choledocholithiasis. After taking food or after having food, pain starts in the abdomen. This pain is very strong and is cramping or squeezing, and this pain increases very quickly. The person with these complaints could vomit after eating food. By all of this, I mean that after having food or after consuming food, the affected person would have severe squeezing or cramping kind of pain in the abdomen, and the person could vomit everything that the person has eaten or consumed. Okay. I also need to inform you that these changes could lead to life-threatening complications. In the Charcot triad, the affected person would have three complaints which indicate a cholangitis: pain in the right side of the upper abdomen, fever, and jaundice. If this triad is present in a person, then the affected person needs urgent treatment depending on the severity of the changes in the affected person. Either non-surgical treatment or non-operative treatment or surgical treatment should be done as soon as possible. Okay. Within 2 weeks or within 3 weeks, a person could develop the issue or the problem of cholecystitis if they eat food or if they consume food which is very high in fat or too high in fat or oils. This period of time is sufficient to create such issues, I believe. Although oil is necessary to prepare or cook many dishes or many food items, many types of oil are not very beneficial to us, or they don't have many advantages among us. I would like to share an experience with you regarding this. About 6 years ago, I did an observership in a big hospital in India. Near this hospital, there was a canteen where I had lunch for about 2 weeks, for around 2 weeks. And this food was very oily. After this, I had some issues. I think I had around two vomitings, or I think I vomited twice on one day, and I had no stomach ache. I mean, there was no stomach pain. And then I met a physician, and during the physical examination, or during my physical examination, when the physician examined my stomach a little deeply, okay, under the ribs, I screamed out of pain. I mean, because of the pain, I screamed out when he, examined my stomach a little deeply. Okay, out of pain. And after that, my abdomen was examined or investigated using the ultrasound investigation. So ultrasound of my abdomen was done, and the ultrasound investigation showed that my gallbladder was slightly inflamed, and there was also sludge in the gallbladder. Okay. I think my gallbladder was in the initial stages of cholecystitis. Then the physician prescribed some antibiotics, and my condition improved. I should I should say that only for around 2 weeks I ate fatty food, and this was the result. Yeah, actually, I didn't know that there was a canteen especially for doctors inside the hospital. Yeah, but after this and till the end of my observership, I ate at this good canteen inside the hospital. Okay, and yeah, as some kind of a conclusion, I would like to say that the risk of gallstones and the risk of cholecystitis can be reduced if the person exercises regularly, and if the person maintains a normal or a healthy weight, and if the person eats or consumes healthy food, or if the person eats in a healthy way. Yeah. But maybe almost no one can have a healthy weight, and that is difficult because of the height, because of the bone weight, and because of many other things, like maybe some hormonal issues in the body and other issues here. It would be quite difficult to reach a healthy weight. But eating or consuming a healthy diet or having a healthy nourishment always helps. And one important factor is that reducing the intake of alcohol, or staying away from alcoholic drinks is always helpful. Yeah, I think that is all I can say on this topic. And yeah, thank you so much for watching this video. I should say that I am not an expert. I mean, I'm not a consultant doctor anywhere. I'm just a trained Indian doctor, or I'm just an Indian doctor with a doctor degree or with a medical degree. The experts or the people who have completed their post-graduation will offer you even better things, like better methods of treatment, or they will be able to inform you better regarding the issues of the gallbladder, or regarding the diseases of the liver. Okay, but I hope I was able to explain everything in detail. I mean, I hope that everything that I explained was in detail. Yeah. And one important thing is that from my side, I believe that anything which is more than the necessary limit is a poison. So limits are important, and they should be respected if possible. Yeah, so that's pretty much it. Please stay healthy. Please take care of yourself. Please have a healthy diet. Please exercise regularly if possible. Yeah. Please take care of yourself. Till next time.